try and relate it, I think, to the needs of Pakistan. And I'm currently working with WHO Eastern Mediterranean region to think around primary care models for Pakistan and other low.
Health Minister Singh and Director General Health Singh, which will definitely enlighten this topic more.
Focusing on the competence of that anaesthetic provider is actually not going to change that practice, because they don't have the opportunity to do that practice because somebody else is in charge of their behaviour. Okay, so you can start to see how we use these tiny behavioural insights to then think, how can we shift the focus of our intervention?
Doctors and other healthcare workers need to serve the population, local population. And how do we make them globally competent but locally relevant, I think is something that's easily forgotten.
I'm going to talk about SAFE Solar program. This is the social health protection initiative.
A higher cost much later on. There may be a disincentive to invest in mental health services.
And what we found out is that for researchers and professionals, they were more like focused on let's say, well-known markers of patient safety like suicide, self-harm, risk to others, adverse drug events, violence. Well,
the problem with this kind of universal health service that we have to be careful with, and this is coming from people who work in the province of Punjab as well, that you see you've got hospitals of as small as 10 beds. A lot of training is done in the teaching hospitals. Now, if the volume of things, it shifts from the teaching hospitals to these smaller setups, the opportunity to train for the trainees actually would reduce.
Then our proportion of the population gets larger, and if we're including in this picture people with ADHD or neurodevelopmental disorders, bigger still.
Now, a number of interventions around physical health, particularly around things like reducing smoking, targeting diabetes prevention, improving physical health outcomes in psychosis, and also a firm believer that there's no health without mental health, and that's why we have a physical component to our division as well.
I think positive psychology has much to offer Pakistan. Pakistan can help positive psychology.
Take that to Pakistan, it would need translating into Urdu, and I understand Professor Nusrat's team specialise in doing these sorts of translations.
I don't need, do not tell me where the destination is.
You need projects, and pillars delivered projects that meet key needs. It's needs of the country, it's needs of individuals. There's a lot of distress around that's unmet, massive amounts of distress.
And it is important early on to remember how standards are set and who sets these standards, because that is really where everything trickles down from. So again, in the UK, General Medical Council, General Nursing Midwifery Council, obviously equivalents for pharmacy, dentistry, allied healthcare professionals, whatever profession you're in.